Imagine this scenario. It is a beautiful Tuesday morning. You wake up, you stretch, and you walk into your kitchen. You are trying to be healthy. You want to live a long life for your grandchildren. So you ignore the bacon. You ignore the pancakes. Instead, you reach for a bowl of fruit and a tall glass of juice. You sit down, you enjoy your breakfast, and you feel proud of yourself. But what if I told you that inside your body, a silent alarm has just been triggered? What if I told you that the specific fruit you just ate is currently interacting with your blood pressure medication? It is thickening your blood. It is spiking your insulin levels to a dangerous height. And while you go about your day, your risk of a stroke or a brain bleed has just skyrocketed. Hello and welcome back to our channel. If we haven't met yet, I am here to tell you the truth that most nutritionists are too afraid to say. We have been brainwashed. For 50 years we have been told, an apple a day keeps the doctor away. And for a 20-year-old, that is true. But you, my friend, are not 20 anymore. When you cross the threshold of 60, your biology changes. Your kidneys filter potassium differently. Your liver produces enzymes differently. And your blood vessels become stiffer. This means the healthy habits of your youth can become the toxic habits of your senior years. Today, we are going deep. We are not just listing fruits. We are going to explain the chemistry behind why these 6 specific fruits can be dangerous for seniors, especially if you are taking statins, blood thinners, or beta blockers. Please, grab a pen and paper, because the last fruit on this list, it is the #1 breakfast item in America, and it is arguably the most dangerous liquid you can put in your body after age 60. Let's begin. Fruit number 1, the grapefruit, and its cousins, pomelos and Seville oranges. This is not just a fruit. In the medical world, as we call this, the medication disruptor. Here is the science you need to understand. Your liver is your body's filtration plant. Inside your liver, there is a specific team of enzymes called CYP3A4. Think of these enzymes as the Pac-Man of your body. Their job is to eat up medications, break them down, and safely clear them from your system. But grapefruit contains a compound called furanocoumarins. When you eat a grapefruit, or drink the juice, these compounds shut down those enzymes. They tie up the Pac-Man. So what happens? Let's say you take atorvastatin Lipitor for your cholesterol, or nifedipine for your blood pressure. Because the enzymes are blocked, the medication doesn't leave your body. It stays in your blood. And then you take your next dose tomorrow. Suddenly, you don't have one pill in your system. You have the potency of 5 or 10 pills circulating in your veins. This can lead to rhabdomyolysis, where your muscle tissue breaks down and poisons your kidneys. Or it can cause your blood pressure to drop so low that you faint, fall, and hit your head. For a senior, that fall can be fatal. The fix: if you love citrus, switch to oranges, lemons, or limes. They give you the vitamin C without the enzyme blockade. Fruit number 2, the most popular fruit in the world, the banana. But wait, you ask, aren't bananas good for potassium? Yes, and that is exactly the problem. As we age, our kidneys lose some of their ability to filter excess minerals from our blood. Now, add medication to the mix. Millions of seniors take ACE inhibitors like lisinopril or angiotensin receptor blockers like losartan. These drugs are fantastic for your heart, but they have a side effect. They make your body hold on to potassium, shutterstock. If you are taking these meds, and you eat 2 or 3 bananas a day, you are creating a potassium storm in your blood. The medical term is hyperkalemia. When potassium gets too high, it interferes with the electrical signals that tell your heart to beat. It can cause palpitations, it can cause chest pain, and in severe cases, it can cause the heart to simply stop. And let's talk about the sugar. A green banana is mostly resistant starch, which is good. But a brown overripe banana, that starch has turned into pure glucose and fructose. Eating a brown banana is biologically the same as eating a candy bar. It spikes your blood sugar, which thickens your blood, making it harder for your heart to pump. The fix: you don't have to ban bananas, but follow the rule of half. Eat only half a banana at a time. And eat them when they are yellow-green, not brown. Or switch to avocados. They have even more potassium, but 0 sugar. Fruit number 3. This one is hiding in your pantry right now. Canned fruit cocktail. Peaches, pears, and cherries in syrup. Let's be very clear. The canning process destroys the vitamin C. It destroys the live enzymes. And then, manufacturers drown the dead fruit in heavy syrup or light syrup. Do not be fooled. That syrup is high fructose corn syrup. Why is fructose dangerous for seniors? Unlike glucose, which your muscles can use for energy, fructose goes straight to your liver. Your liver is likely already tired from decades of work. When you flood it with liquid syrup, the liver panics. It converts that fructose immediately into triglycerides, blood fat. High triglycerides are the primary driver of atherosclerosis, the hardening of the arteries. Hard arteries cannot expand. So when your blood pressure rises, the vessel doesn't stretch. It bursts. That is a hemorrhagic stroke. The fix. If it comes in a can with syrup, it stays in the store. Buy frozen fruit. Frozen fruit is flash frozen at the farm. It retains all the nutrients and has zero added sugar. Fruit number 4. The mindless snack. Grapes. I know. They are easy. You wash them, you put them in a bowl, and you eat them while watching the news. Before you know it, you have eaten 30 or 40 grapes. Here is the issue. Grapes are what we call a high glycemic load fruit. They have very thin skin and almost no fiber. They are essentially little balloons of sugar water. When you eat them, they bypass your digestion and hit your bloodstream in minutes. For a senior, this causes a massive insulin spike. Insulin is an inflammatory hormone. Chronic spikes of insulin damage the endothelium, the delicate inner lining of your blood vessels. Think of your blood vessels like a garden hose. Sugar acts like sandpaper inside that hose. It scratches the lining. Your body tries to fix those scratches with cholesterol plaque. Eventually, that plaque breaks off, travels to your brain, and blocks blood flow. The fix. If you want a pop of flavor, choose blueberries or raspberries. They have a lower glycemic index, and they contain anthocyanins compounds that actually repair the blood vessel lining. Fruit number 5. Mangoes and tropical fruits. Mangoes are delicious, but they are nature's dessert. One average mango contains 45 grams of sugar. To put that in perspective, the American Heart Association recommends a maximum of 36 grams of added sugar per day for men and 25 grams for women. One mango blows your entire daily budget. As we age, our metabolism slows down. We become more insulin resistant. We cannot process that massive load of carbs effectively. Excess sugar in the blood leads to a process called glycation. This is where sugar molecules bind to proteins in your body, making them stiff and inflexible. Stiff blood vessels, high blood pressure equals stroke risk. The fix. Portion control is everything. Treat mango like cake. You wouldn't eat a whole cake. Don't eat a whole mango. Have a few slices and pair it with Greek yogurt or walnuts. The protein and fat will slow down the absorption of the sugar, protecting your brain from the spike. And finally, fruit number 6. The great breakfast lie. Orange juice. I want you to look at the glass of orange juice on your table. That is not health. That is metabolic poison. But doctor, it has vitamin C. Yes. And a vitamin C pill has vitamin C, without the 30 grams of sugar. Here is the reality. To make 1 glass of juice, you need 4 to 6 oranges. You squeeze out the water and the sugar, but you throw away the pith and the fiber. Fiber is the antidote to sugar. It forms a mesh in your gut that slows down digestion. Without the fiber, that orange juice hits your liver with the force of a tsunami. Studies have shown that drinking fruit juice is linked to a higher risk of type 2 diabetes and obesity in seniors. And remember, diabetes is one of the strongest risk factors for stroke. Every time you drink that juice, you are aging your brain. The fix. Eat the orange. Peel it. Eat the white stuff, the pith. Chew the segments. Your body needs to work to get the sugar out. That is how nature designed it. Or simply drink water with a squeeze of lemon. It alkalinizes your body without the sugar crash. Now, I don't want to leave you fearful. I want to leave you empowered. Fruit is wonderful. If you follow the 3 golden rules of senior snacking. Rule number 1. The berry best. Always prioritize berries, strawberries, blackberries, blueberries. They are low sugar, high fiber, and packed with antioxidants that fight brain aging. Rule number 2. Never naked. Never eat fruit naked, meaning never eat it alone on an empty stomach. Always put clothes on your carbs. Pair your fruit with a fat or a protein. Apple with peanut butter. Berries with yogurt. Melon with cheese. This combination blunts the insulin spike, keeping your energy stable. Rule number 3. Timing matters. Stop eating high-sugar fruits at night. Your metabolism sleeps when you sleep. If you eat a bowl of grapes at 9 p.m., that sugar sits in your blood all night long, destroying your vessels. Eat your fruit before 2 p.m. Let your body burn it off while you move. Aging is not a disease. It is a privilege, but it requires a new strategy. Your body has served you well for 60, 70, or 80 years. Now, so it is asking for a little extra care. It is asking you to be mindful. By making these simple swaps, by choosing the blueberry over the grape, by choosing the water over the juice, you are not dieting. You are defending your brain. You are protecting your memories. And you are ensuring that you are here, strong and sharp, for the people who love you. I want to hear from you. Be honest. How many of you start your day with orange juice? It's okay. We all did. But are you willing to try the lemon water challenge instead? Tell me in the comments below. I'm swapping the juice. If this video opened your eyes, please share it with a friend or a loved one. You might just save a life today. Hit that subscribe button and turn on the bell. We are building a community of seniors who refuse to age passively. Stay healthy, stay wise, and remember, you are just getting started. I'll see you in the next video.